Thank you, Linda, and how wonderful to see so many friends and colleagues, and I look forward to meeting those who haven't yet met. I'm Susan Mickey. I'm Director of the Centre for Behaviour Change at University College London and also co-director of BR UK, along with Linda. It's my great pleasure this morning to introduce Professor Ralph Hertwig. He's a cognitive psychologist and behavioural decision scientist whose work has genuinely expanded the boundaries of behavioural science, both in theory and its application to public policy. So I think we're incredibly fortunate that Ralph has come from Germany. He's director of the Centre for Adaptive Rationality at the Max Planck Institute for Human Development in Berlin, in Germany. And we're also fortunate that he's chair of our International Scientific Advisory Committee, which has been very supportive and helpful in the work of BR UK. Professor Hertwig has many accolades and too long to take time up here, but his most recent is the Alias Memorial Prize in Behavioural Sciences in 2026 in recognition of his outstanding contribution to decision-making research. Professor Hertwig's work challenges us to think more carefully about human rationality, decision-making and influences on behaviour, not as a catalogue of biases to be corrected, but as a set of adaptive capacities that, with the right support, can be developed and strengthened. And I think this outlook is very much in line with both BR UK and Centre UB. His scientific and policy contributions often intertwine, as illustrated by his work on boosting as an alternative to nudging. Recognising the scientific and applied limits of nudging, Hertwig has championed a distinct kind of intervention called boosts, whose objective is to foster people's competence to make their own choices, enabling them to exercise genuine agency. Boosts are transparent, non-manipulative, and designed for lasting impact, an approach that works with people rather than around them. Professor Hertwig was a member of the expert panel advising the German government during the COVID-19 pandemic, as I was to the UK government. And our similar experiences during the time I was advising the government led us to a collaboration on a joint article called Moving from Nudging to Boosting, Empowering Behaviour Change to Address Global Challenges. And it also includes two other authors associated with BR UK, published in Behavioural Public Policy. His most recent book is Deliberate Ignorance, Choosing Not to Know, and in January 2027, his latest boost, which is simply called Boost, is being published. So I think this gives you an indication of the treat that we're about to experience. And just to say that Professor Hertwig has said that he will speak for about 35 minutes, which will leave us 10 minutes for questions and discussions. So please do make a note during his talk and come in quickly when there is an opportunity to ask questions at the end. Thank you very much. The floor is yours.
So good morning, everyone, and thank you very much, Susan, for the kind introduction. Thank you very much, Linda and Susan, and organizers here in Birmingham for inviting me to Birmingham. It's a great pleasure to be here and to talk about Boost. Now, I was thinking about how do I preface this talk to make it also interesting for you, and I thought I'd try this. I think the UK is really blessed. Is blessed in having two very strong traditions, research traditions, that work on behavior change. And there's on the one hand, the research that is being inspired by the COM-B framework or the behavior change wheel. And there's on the other hand, another framework that's called nudging, and you are all familiar with the Behavioral Insight team that made it into Downing Street 10. And what I find interesting about these two traditions, they don't seem to talk to each other. At least if you really look closely, then you don't really see much citations or referencing of each other's work. And this is kind of surprising because the assumptions are quite different. in the COM-B framework, you have an emphasis as one of the pillars of behavior change on capabilities. And I translate that for the time being for today into competences. And there's also an emphasis on motivation. There's, of course, also an emphasis on opportunities and opportunity structures. But on the other hand, in the nudging framework, competences don't play any role at all. And in fact, motivation is used to the extent that we can also enlist the lack of motivation, namely inertia. So it seems that there's enough reason to talk to each other because the assumptions about human behavior change, they are quite different. And what I thought is that this kind of debate between these two fields that hasn't occurred yet, to some extent is taking place between boosting and nudging. And I hope that doesn't sound too pretentious, but to some extent I'm thinking that the kind of arguments that I've had over the years with the proponents of nudging is the kind of debate that could have happened between these two camps in the UK. Again, I hope that doesn't sound too pretentious, but I thought maybe you find that aspect interesting, that this is a debate that could have happened. Okay, let's get started. And the first argument that I typically have with proponents of nudging is the argument, why is empowerment in behavioral public policy needed? And there are all kinds of reasons. There's a long list including philosophical reasons, values, but there are also very concrete pragmatic reasons. And I only want to introduce you to two of those reasons. The first one is, in my view, we need to equip people to meet global challenges. What do I mean? What I mean is we are currently facing a time that many people describe as a polycrisis, which is the simultaneous occurrence of several crises that amplify each other. And you all know them: pandemics, climate change adaptation, democratic backsliding, polarization in our societies, the spread of mis and disinformation, the global youth mental health crisis, the rise of generative AI, and the sense of illusion of knowledge. This is called epistemia. And this is an incomplete list. And my argument would be that in this polycrisis, we need collective action, and we need agentic citizens, and we need competent citizens. And in my view, this requires also a different kind of approach to behavior change and behavioral public policy, an approach that puts emphasis on competences and not just on choice architecture. Now, you may be surprised, but that's exactly what we wanted as policymakers during the time of pandemic. Because if you think about the pandemic again, if you look back to it, what we wanted was an active, competent citizen. And let me just give you a few examples. We asked citizens at the time, from one moment to the next, to start wearing masks and to do it in a proper way. We also asked them for behavior change in terms of regularly washing your hands, at least in the very beginning, and also following certain hygienic rules when, for instance, sneezing. We also asked people to follow the rules of physical distancing, and we asked them to self-administer tests and to interpret the test results and to also follow suit on the results in terms of self-isolation or going into quarantine. We also confronted people with pretty sophisticated statistical concepts such as exponential growth or the famous factor R, and expected them to understand that. And last but not least, and that was perhaps the most powerful change that we expected people to implement, is many people started working from home. From one day to the next, we asked them to make a real behavior change, to jiggle the simultaneous demands of private life and family life and professional life to help the children to keep their education and school training. And we did that from one moment to the next. And that only works, in my view, that only works if we also invest into people, if we invest into agency, and if we invest into competences. But this is not the only reason. There's another reason. And this other reason has to do with the kind of world that we have created. If you think about it, we have created in many regards an ultra-processed world. What do I mean with that? This is a world in which sophisticated consumer environments have been created. Think, for instance, about the food environment and the fact that up to 60–70% of today's food in the United States, for instance, but also in Europe, are ultra-processed. They perfectly serve our preferences and exploit our preferences. But it's not just the food environment, it's also the digital environment that is a highly sophisticated environment. And staying healthy and staying sane in that kind of environment, again, requires competences. And let me just give you one example. The commercial of the kind of environment that we have created, the commercial products of just 4 global industries were linked in 2021 to 2.7 million deaths in the WHO European region, which amounts to about 1/4 of all deaths during that year. And I guess you all know which industries I'm talking about. I'm talking about the tobacco industry, the alcohol industry, the food industry, and the fossil industry. And I haven't even touched upon maybe the most sophisticated choice environment that we have created, that commercial choice architects have created, and these are digital technologies, social media, which are by design meant to be addictive. And you know all the functional features that are in place in order to do that: infinite scrolling, pull to refresh, push notifications, algorithms and personalization, and so on, and so on, and so on. And these technologies, they have consequences for the individual user. We, for instance, have the ongoing discussion about what is the association between the mental health crisis that we observe in our young people and the addictive and risky use of social media. And I won't walk you through all these, and these are associations, admittedly associations, because in this case, causality is very hard to demonstrate. But the situation has become so bad that the Lancet Commission on the Mental Health of Youth has now argued that there is a global mental health crisis among young people. Now, I wouldn't argue, and don't misunderstand me, I wouldn't argue that competences is the solution to these problems. Of course it is not. What we really need is a mixture of different policies. But what I would argue is that competences is a first line of response to these problems. And we need such a first line because a lot of the other entry points, whether it's law or ethics, whether it's technology, whether it's education, they take time. And in the case of regulation and law, they are also subject to lobbying interest. So what I'm arguing is that we need a policy mix, and this policy mix, in my view, needs to include competence enhancement. It also needs psychological and behavioral science in terms of nudging, in terms of boosting, in terms of the COM-B framework, and many other approaches as well. Now, okay, maybe I can convince you of that we need competences. But is that a good investment? Because the typical argument that you will hear from the nudging camp is that it's not a good investment. And that this kind of competence formation is maybe not even feasible. And let me walk through the arguments. And let me walk also through the kind of portrayal of human decision-making skills that you typically would find in large parts of my field, which is behavioral decision-making, and in large part of the nudging research. And this portrayal of human decision-making skills can be characterized by what Lola Lopez, who is a very well-known decision-making scientist, has called the rhetoric of irrationality. The rhetoric of irrationality. And let me just give you a few examples. Thaler himself, one of the inventors of the nudging approach, has argued that mental illusions should be considered the rule rather than the exceptions. With mental illusions, he refers to the kind of cognitive biases that have been identified within the heuristics and biases program by Kahneman and Tversky. And as you know, the heuristics and biases program is the conceptual foundation for the nudging approach. So mental illusions, think about this sentence. Mental illusions is not an exception. This is the rule. We are full of mental illusions. There is, if you will, also an industry of the production of mental illusions and of the documentation of mental illusions. And in an early paper in the American Economic Review, Thaler and Sunstein detailed the kind of cognitive illusions in more detail, and they argued that people do not exhibit rational expectations. They fail to make forecasts that are consistent with Bayes' rule. They use heuristics that lead them to make systematic blunders. So heuristics, the simple rules that we are using, are the culprit behind all the blunders that we are committing. And we exhibit preference reversal, and we change our choices depending on the wording of the problem. That's the framing issue. And if you turn to the nudging book, it doesn't matter which edition you look at, you find more of these statements that describe us as mindless, passive decision makers, as people who often make mistakes because we rely just too much on our automatic system. And many people will take whatever option requires the least effort or the path of least resistance. And we are characterized by inertia, status quo bias, and the whatever heuristic. This is what Lola Lopez called the rhetoric of irrationality. And indeed, if you accept this rhetoric of irrationality, it's also very clear that we shouldn't waste our time with investing into human competences. Instead, what seems to be the much more efficient way of going forward is to focus on choice architecture. And here's a very famous definition of choice architecture, which is essentially any aspect of the choice architecture that alters people's behavior in a predictable way without, and that's important, without forbidding any options. So we are not talking about regulation or law, and without significantly changing the economic incentives. And this is an important formulation because it means that these are very inexpensive interventions. And that's the promise. We can change human behavior in a very inexpensive, in a very efficient way. And later on, Sunstein then made the distinction between what he called architectural nudges, which is the core of nudging because that's the innovative core, the idea to make these little changes to the choice architecture in terms of default, friction, positional effects, etc. And as a second category, educative nudges. Now, I would argue that educative nudges came later as a response to the boosting argument. But there's a very close and very narrow understanding of education here in terms of warnings, in terms of disclosure of information, in terms of reminders. That's what education is meant here. And if you look actually more closely into the index of the nudging book, you will find that there's not a single time that the word learning is being used or mentioned in the index of the nudging book. In other words, we are living in a behavioral change environment in which learning, which is perhaps the most important human ability that we have, doesn't play much of a role anymore. Now, this is a very well-known example and implemented here in a German university cafeteria of an architectural nudge. And what you see here is essentially the idea, if you look on the right side, that we put the healthy food up close and put the unhealthy options that people can also choose further away, thereby creating friction and making use of people's inertia. Now, let me emphasize that I have absolutely no problems with that kind of choice architecture intervention. Why would we not, given that we have the ability as public choice architects to change this choice architecture in a way that helps people to make better decisions? Why would we not do that? This is perfectly okay with me. However, just think about it. This is just a tiny sample of the choice architectures that are available to a benevolent public choice architect. In reality, most of the choice architectures that we face look like this. And this is just a random photo I took myself when I was in Tromsø, which is at the very northern tip of Norway. And I walked into a random supermarket and I was fascinated by this photo here and by this assortment of candies. And that's the kind of choice architecture we face most of the time, which means, in my view, we need competent citizens to deal with that kind of choice architecture, because the commercial choice architect have different interests than the one that we have, or they not necessarily overlap. Now, okay, so maybe I've convinced you that we need competences, but is it a good investment given that people are such dismal decision makers? Now, here I now speak as a cognitive scientist or a behavioral scientist, because what I would argue is that the kind of picture that has been portrayed in the nudging literature and by Kahneman and Tversky is not fully representative for the state of the research and the findings in that very field. In reality, you will find various research programs, and very powerful ones and influential ones, that suggest that, yes, we are entitled for good reasons to invest into people's competences. And I give you 4 examples of these research programs. Now, I won't go into much detail, because each of these research programs would deserve their own lecture. But I want to convince you, not convince you, I want to give you the choice. And ask you, if you are interested, look into these research programs. And you suddenly will see there's a very different kind of rhetoric, a very different kind of framing, and very different set of empirical results. Let me begin with this first paper, which is actually written by myself and a colleague of mine, Thomas Lescher-Rager. Why did we write that paper? Kahneman and Tversky, they did not invent the research on intuitive statistical reasoning. There was a research tradition that is today called intuitive statistician, the mind as an intuitive statistician, that started in the 1950s and 1960s. It was instigated by Ward Edwards, who is the father of behavioral decision-making research in psychology. And in the 1950s and 60s, many experiments, the result was such that the argument was that if you want to model human decision-making and human intuitive statistical reasoning, you're well advised to start with the models from statistics and probability theory. People are that good. People are that good that we actually can just borrow the models from statistics and probability theory, and then we understand enough about people's intuitive statistical reasoning. Now, that's the total opposite of Kahneman and Tversky. Kahneman and Tversky, who came into the early 1970s with their research, arrived at a very different conclusion. Why is that? And that's the answer. That's the question that we asked in that particular paper, and here is one answer. Kahneman and Tversky not only ushered in a new way of thinking about intuitive statistical reasoning, they ushered in a new way of running experiments. And the experiments, and you all know the Linda task and the Tom W task and the maternity ward problem and so on, they are all text vignettes. Simple text vignettes where you give one answer or 2 answers, and based on that you are being determined to be a Bayesian or not a Bayesian, to be somebody who follows the conjunction rule or not, which again means there is no learning involved in all of this. This is only text-based responses. It's almost like you are going to school and do an exam, except that there was no training, no school education before. Now, if you look at the research in the 1950s and 60s, it's very different. It's an experimental protocol that one can describe as experiential, which means that the information is introduced in a sequential way. There were often many, many trials. In Bayesian reasoning studies, there were up to 400 answers that people gave, not 1 or 2, up to 400. There was feedback, there was a physical implementation of the experiments. The experiments were much more cumbersome, much more engaging, much more effortful. What Kahneman and Tversky did, they reached a very different kind of protocol, and in a way made the experimentation so much easier, because you go into the classroom and you give the tasks out and people respond to that. So what we are arguing in that paper, if we want to understand why in the research in the 1950s and 60s, people seem to be good intuitive statisticians and bad intuitive statisticians in the 1970s and on, we need to look at the experimental method. That's the key to the difference here. In one experimental method, there is learning. In the other experimental method, there's no learning whatsoever. But it's not the only line of research that we can rely on. There's another line of research on smart heuristics, and that's a research field that was started in Berlin at the Max Planck Institute for Human Development by Gerd Gigerenzer, and then we continued and built on that. And that's the idea that the culprits of behind cognitive illusions, namely heuristics, are actually an indispensable tool for all those situations of human decision-making that are characteristic of our everyday decision-making, namely limited information, high uncertainty, incommensurability, and whatever, other things. And what we showed in that research is that these simple heuristics, because they don't overfit and because they have lots of other interesting properties, they can actually be as good and sometimes even better than more complex strategies. And we made the argument, and I would argue that this is a fair argument, this is an indispensable tool. In most situations in the real world, we need to rely on heuristics, and they are actually overall pretty good. Here's a third line of research by Gary Klein, and that's called naturalistic decision-making. What Gary Klein did as a psychologist, he went out of the experimental laboratory. He started studying real decision-maker, real professionals, nurses, police officers, firefighters, soldiers, doctors. And what he found is that in most cases, they make really, really good decisions. And his metaphor that he developed is that the human mind is a powerful pattern-matching machine. And with that, he meant is that if you encounter a new situation, you map that new situation onto the patterns that you already have from the past. And with that match, you not only understand the situation better, but on top of that, you also get for free all the solutions of the past, and then you can bring them to bear to the new situation. That was his notion of why people are so good decision makers. And last but not least, there's also a totally different view, namely that the human mind and the human brain is a powerful Bayesian prediction machine. And that's research that is also very powerful here in the UK, but also in the US at MIT with Josh Tenbaum. Here it is Nick Chater who has worked on that. Now, I don't ask you to take sides here. That's not the issue. But I want to convince you that if you look into that field of decision-making, you will find answers that go far beyond the rhetoric of irrationality. And in a way, in the nudging approach, it seems to me that we are only being presented with one view, and this is only one possible view, but there are many others. So if you take this, my view or my summary of the decision-making research seriously, then I think we are entitled to think about boosting. And with boosting, what is meant is that we are trying to build or strengthen competences to enable specific behaviors that are endorsed by citizens. And that also means that we can leverage cognition, decision rules, strategies, etc., habits, routines, but we can also leverage the environment. We can think about the choice architecture, for instance, in terms of information design, but also in terms of the physical structure and content that we can make use of in order to help people to develop competences. Importantly, we want to, with boosting, preserve agency, because as I told you, in my view, we need agentic citizens. We need citizens that are able to show agency. And that also means that the adoption of the boost is voluntary and is aligned with users' goals, because otherwise they wouldn't engage with the boost. And last but not least, we need transparency about the boost's objective, because again, I can only offer, the boost is an offer, and it's not something that I'm imposing on people. Now, I won't go into that. This is an attempt to conceptually distinguish between boosting and nudging. If you are interested, you find that in that paper in 2017, a paper that I co-wrote together with Till Grüne-Janov, who is my colleague and friend in this enterprise on thinking about boosting. And Till, interestingly, is a philosopher from Stockholm University, and it's a kind of an interesting combination to have a behavioral scientist and a philosopher working together on that topic. And I can tell you it's very interesting to do that. So we skip that. And let me give you 3 examples. There are many more, of course, but I picked these 3 examples for the following reason. I want to show you that you can use boosts in very different domains that are relevant to policymakers. And I also want to show you that boost doesn't need to take lots of time. They can also be very smart, very fast investments in the same way that nudge is often being considered to be fast and inexpensive. So let me give you a few examples. And the first example is from the domain of dooring. Now, you are probably all familiar with dooring, which is something that can happen to you when you are riding your bike through city traffic. And here's a video of it. I don't think I have to give you a trigger warning, but it illustrates the problem of dooring. If you don't want to see it, close your eyes. Yes. So fortunately, the car stops and the video also stops here. And what you see is that this kind of accident can, of course, lead to pretty terrible injuries. It can even lead to death. But there's a hidden cost to dooring. And the hidden cost to dooring is that many people argue, and in the UK it's estimated that 1 out of 3 people say, I'm not riding my bike in the city, I don't ride to work or to school, because I'm afraid of these kind of accidents. So if we were able to reduce the risk of these accidents, we would not only avoid the injuries, but on top of that, we would also enable more people to ride their bike to work and to use different kinds of modes of transportation. So what can we do? Now, here's the traditional way of doing that, and I would call that old-fashioned educative nudging. Warnings. And these are 2 historical posters that depict that very accident and that tell people, hey, look before you open the door. Now, if it were only that simple, then of course this wouldn't happen. The problem is that in the situation, you are easily distracted. You are looking for your phone and for the car key, and you're turning to your children, and you have all kinds of other things on your mind, and you simply forget. So telling people, hey, look, is not enough. So what can we do? Now, here's a very simple boost, 30 seconds, and everybody who is able to get a driver's license is able to do this. So in other words, the entry costs of this kind of boost should be very low. And this boost is called the Dutch Reach. And the Dutch Reach is called the Dutch Reach because it was originally invented and designed in the Netherlands. And if you go to a Dutch driving school, there you will encounter it automatically. So what is the idea? The idea is that you are being told that you don't open the door with the hand next to the handle, but you take the other hand, the one that is further away. And if you do that, then what happens is that you cannot help. You turn your upper body and you turn your head, and you are suddenly looking into that blind spot that you otherwise wouldn't be able to see. That's as simple as that, the Dutch Reach. And sometimes, of course, you may forget that this is what you are supposed to do before it starts becoming a habit. And therefore, you are also told, hey, why don't you use a memory cue? A memory cue could be as simple as tying a red ribbon to the handle so that when you're opening the door, you get reminded, oh, yes, there was something I'm supposed to do. That's the Dutch Reach. And Dutch Reach has been shown to reduce dooring accidents and is also now being rolled out in other countries, not only in the Netherlands. This is a very simple boost, 30 seconds to explain, and it's a competence that helps us to deal with this problem. And here you also see the difference to nudging. Now, this is a very famous nudging example. Here, what you see is the Lakeshore Drive in Chicago. And the problem here is that people are driving too fast into that very curve. And what the traffic planners of Chicago did is something very interesting. They drew white stripes onto the tarmac. And the distance between these white stripes gets increasingly smaller, which, if you keep up the same speed, creates the impression that you are actually speeding up. And that leads to the response of people slowing down. Cool. And what you see, this is a choice architecture intervention. This is not an intervention on the level of the individual people or of the competences. Now, I've tried to look into that and to see whether it works or not, and in particular, whether it works long time. Because one of the problems that I at least see here is that once people see through it and understand it, will it still work? I don't know, and I haven't found any data. But here you see also the difference. The Dutch Reach in principle should be lasting. And should be in place because I'm not being tricked here. I'm actually, in fact, I'm being helped to deal with the problem that I really want to avoid. And I assume that we all want to avoid dooring. And this is potentially different here. Here's a different kind, and one that I really like a lot. And it's dealing with another behavioral policy problem, namely math anxiety. And math anxiety is a very widespread phenomenon throughout the world. In the United States, it's actually estimated that up to 93% of all adults in the US report some kind of level of severe anxiety when they're dealing with numbers and math and simple mathematical operations. And that's what math anxiety is about. You don't want to expose yourself to numbers and to mathematical operations. And unfortunately, that particular kind of anxiety also travels within the family. So if you have math anxious parents, chances are that you as a kid will also be anxious of math. So what can we do? Now here's an intervention that takes a bit more time and more cognitive effort. And this is an intervention that was proposed by Sheehan Bylog. And basically the idea is that parents, even the math anxious parents, read little bedtime stories that include simple mathematical content to their children. This could be as simple as this. This is your beloved cat, and the beloved cat has a certain number of treats per week. Now you need to divide up these treats between the 7 days. So how many treats does the cat receive on a single day? And even math anxious parents can deal with that because the correct solution and the way to the solution is available to them. Now here's the effect if you do that, and you don't need to do it 5 times a week. Even if you do it once or twice, it already has positive effects. So what these authors found that over the course of a 9-month school year, students who do bedtime math gain an average of a 3-month advantage over their peers. This is a substantial effect. This is an enormous effect. And it's a pretty straightforward boost that we can apply to deal with this kind of policy problem. And the final example that I have is an example of what we called self-nudging. Now, self-nudging sounds like nudging, but it's actually the opposite. Because self-nudging requires that the citizen becomes a choice architect. We speak of the citizen choice architect. And what that means is that we pass on our knowledge about choice architecture changes to the citizens, because they can make all the tiny changes to the choice, to their proximate choice architecture that otherwise the behavioral public policy architect would do. And in this sense, self-nudging is actual empowerment, is empowering people to become citizen choice architects. And here's an example that includes a technology. It's actually an app that was developed in my research group. It's called OneSec. And it's actually now freely available, and actually quite a number of people are using it. And so these guys who came up with that app, the idea was the following. Say you want to control your consumption of Instagram, because that's the one that really attracts you. So how can we help you to do that, and how can you become a citizen choice architect? So here you implement the app, and you also decide the parameters of the app, namely, for instance, the waiting period that will now unfold. So if you try to open Instagram, what happens is that there will be a dark screen, there will be a certain delay. You will be informed that you opened your app 3 times in the last 24 hours, and then there's the question, do you want to open it? And only if you answer that positively, it will open, otherwise it won't. So this is a very simple use of friction, but it's up to you. It's up to you to decide, is it Instagram or is it something else? It's up to you to decide, is it 3 seconds or it's longer? So you are the citizen choice architect, and you are imposing this friction on you. What are the effects? The effects are, again, really amazing. So what these guys found is that within a 6-week period, there was a 37% average reduction of app opening attempts by users across 6 weeks. This is a pretty substantial effect. And this was recently studied also by the Danish Consumer Competition and Consumer Authority. And what they found is, also implementing that app and various other interventions, that this particular app leads to a reduction of 36% of daily time that you are on social media. Again, this is a substantial effect. But again, it only works because we are empowering the citizens to become citizen choice architects. So with that, I also come to the end and end with a shameless self-advertising, but maybe Susan, you already did that for me. So this is going to be a book on Boost, and the only thing that I find interesting about this table here is that what you see are the many different domains in which you can use boosting. You can use it for sustainable consumption, for navigating a world of disinformation and misinformation. You can use it in order to reckon with risks, and you can use it, for instance, to regulate your emotions better. So boosting, in my view, is a real alternative to nudging. And again, my argument would be, in order to deal with all the many crises in the world, we need people who are willing to show agency and competences. And again, that's not the solution. We need to combine it with other interventions. But without competences, I just don't simply see how we are dealing with the problems in the world. Thank you very much.